This is a place where I think there's a lot of like-minded physicians and other staffers that come into it and say, hey, our goal is to build something that matters to this community. We're going to be here for patients for the duration, however long that is.
I mean, the purpose of making the Cancer Institute is to streamline patient care, give better access, better touch points for the patients to be able to get the care that they need.
Welcome, I'm Andy Banker, and today we're talking about a state-of-the-art cancer institute in the St. Louis region with incredible personalized care. Really, it's the kind of care only a private practice can provide. Dr. Greg Auffenberg and Dr. Seth Strope are here to explain why this is so important to your health care. They are directors of Urology of St. Louis Cancer Institute. Thank you both for being here.
Thank you.
Thanks for having us.
Why did you decide to open the Cancer Institute in St. Louis? Why do you think the St. Louis region really needed it?
Sure. Thanks for the question. And I think before I dive into that, probably even backing up a little bit, I think a question for both of us is why Urology of St. Louis more broadly, and then the Cancer Institute within it. Both Dr. Strope and I came to Urology of St. Louis after we were practicing in other environments. Both of us have worked in academic settings, larger medical institutions in various cities across the country. And ultimately, we're both drawn to Urology of St. Louis, which is a large group of physicians that's existed even longer than both of us. It's the most established, most experienced urology group in the St. Louis region. Our scope in terms of coverage, both of geography of the St. Louis metro area, but also number of patients, is extremely large. And frankly, I think as both of us considered the group, we found a group of physicians that was really, in our opinion, unmatched in the area, both in terms of training, the degree of subspecialization within the group, and the quality of care they provide, but also, I think, within the people in the organization, how strongly they feel about delivering the highest quality of care. And I think, to your question about why the Cancer Institute, I see it really as an extension kind of what the group both before and with us has already been doing, sort of more formalizing this approach, both by giving it a more specific name. We also have a geographic footprint where there are two sort of central node clinics that embody our Cancer Institute with many outlying clinics as well, to kind of give it a more of a foundation upon which to build the multiple facets of cancer care that I think most patients are accustomed to, especially at bigger centers. So the physicians are a part of it. Nurse navigation, nurse practitioners, research staff, other support staff, and kind of a specialized touch in helping these patients navigate their journey of care with us, which is often a rather longitudinal journey. We really felt it was important, yes, to have extremely talented doctors at the top of it, which the two of us are part of that, but it extends far beyond us on the physician front with our partners. But also it allows us to kind of build the larger infrastructure that we think patients with these issues really need to navigate their journey.
Dr. Strope, he mentioned the word team, and that
Yes.
kind of goes to where I was going to go next. What makes the Cancer Institute different from any other place you might look to get care?
I think it was what Greg was starting to talk about there, which is, we have dedicated team members who are there to help the patients throughout their journey, whether that's the medical assistants or the nurse navigators or the pharmacy benefits people. There's someone that is there that the patient can call, can get in touch with, and can help to navigate through issues, whether it's the insurance side, the pharmacy side, or the patient care side. And that's something that sometimes when things get too big, larger institutions, you lose that personalized touch. And that's something that our Cancer Institute does give patients.
It sounds like you found a niche that needed to be filled in St. Louis, and that's what you're doing.
And then I would also say, too, the geographic reach of our practice as a whole allows patients to start closer to their home, get the specialized care in when they need it. And then if it's something where they want to transition back to, say, their original doctor that's further away, we go all the way from Litchfield to the north to Farmington to the south with where our physicians go. And not every patient's going to want to do every visit back up to St. Louis. We have that capability where when patients need to be seen locally, they can be seen locally. But when it's something where they want consultation or someone needs to be seen for the more specialty care, we can move them in and do that when they need that.
Talk a little bit. I mean, you both have sort of a wide range of experience in your medical histories. You touched on it, Dr. Auffenberg. What brought you to St. Louis?
I think we both have slightly different stories, but for me, I grew up in St. Louis, and so my family's been here for generations. This is home. I love St. Louis. I left St. Louis after high school, and most of my school, medical training, things like that, was outside of St. Louis. But all along, kind of like many St. Louisans, it was in my heart that I wanted to make it back here. And I think, as I went through many different cities across the country, many large institutions, things like that, that was always a pull. And for me, it was kind of trying to find the place that I felt like I would be able to bring all that I had sort of gained in education experience outside of St. Louis back here, and trying to find a platform where I felt that it could be best deployed. And I very strongly feel this is the place it is.
For me, my journey was a little bit different. I mean, I started out, not from the area, but came to the area for my initial academic position at Washington University, was there for 7 years, and then had an opportunity to go help start a cancer center elsewhere. But for my kids, St. Louis was home. I mean, this is where they grew up. And after a couple of years away, actually less than a couple of years away, it's kind of like, no, made more sense for us as a family to come back to. And then it was all the reasons that Dr. Auffenberg outlined, where, why Urology of St. Louis instead of going back into academics. And having been away from academics for a little bit, I realized I really like treating patients. And I wanted to be patient-focused, not research-focused or bureaucracy-focused or, career status rung focus. And that's kind of why I came back to Urology of St. Louis. It was for the people and for all those things.
Obviously, your background shows there are other things you have done and could be doing, but you chose this. And that should send some kind of a message to patients out there, right?
Yeah. I think absolutely. And I think for both of us, the word you picked is very apropos, which is this is a choice. I think we have both chosen to work here. And I touched on a few of the reasons why before. I think ultimately it comes down to a feeling that honestly, our opportunity to provide the highest quality of care that we feel we possibly could is best facilitated through this group. And that's with other options, both in town and out of town, that we could both be working at, that there's something special about this group. And I think to a doctor, we see that. I think hopefully to most of our patients, we convey that very quickly to our staff. The reality is healthcare is changing a lot. And has been over the last couple decades. There's a lot of consolidation of who's sort of running different institutions, to different organizations are kind of coming under the umbrella of these mega conglomerates and things like that. Some of that's for good, and we don't have to dive super far into that. But I do think that brings some constraints and some challenges there for people both working inside of those environments, for patients trying to engage those environments and things like that. And I think to both of us, one of the things we had seen is for care providers, and probably many patients have seen this, there's been an inordinate amount of turnover in a lot of healthcare organizations over the last several years. And, I think to a doctor in an organization, I think no one really wants to go somewhere thinking, I'm just here for 2 to 3 years and then we'll move on to the next thing. I don't think in any of us that's what we're looking to build. We're looking to build something that hopefully will be longer standing and sort of a fixture in the community. I would also say as a patient, as a patient myself, as having family members, patients, but also hearing it from my own patients, I think we all could sort of tell a story about how sort of jarring it is to see or to have to deal with, hey, I started some complex care journey with a doctor that now has left town or is somewhere else and I can't see them anymore because of insurance reasons or things like that. I think to me, and I think I speak for Dr. Strope too, we saw a group of doctors that existed even before us. Many of our partners have been in this exact group for 20 years or more. We haven't lost a new doctor coming into our group in many, many years. In other words, this is a place where I think there's a lot of like-minded physicians and other staffers that come into it and say, hey, Our goal is to build something that lasts, not have these be 2 to 3 year pit stops on a greater journey, is to build something that matters to this community. We're going to be here for patients for the duration, however long that is. And to us, I think that was very important. And so to me, that was probably the biggest thing about, this group beyond just the people, was within the people I saw this is something that people care about bringing to this community for the long term. And that really resonated with me, and that's something I want to be a part of.
Yeah, and let me also add a little bit about the access issue, because the Cancer Institute isn't just the two of us. It is all of our partners who have been delivering this high quality care for, like Greg was saying, for 20 plus years in many cases. And that access is so important, because I do hear that a lot, patients who can't get in to see a specialist, can't get in to see someone. Oh, my doctor referred me to, this place that was in, their network and their, consolidated group. And they told me I couldn't see someone for a month, for 2 months, for 3 months. Patients can get in, find out what's going on. And then if it's something that needs the extra care of the Cancer Institute, get over to us. And that's, I think, the real difference that we can provide. And also, our partners don't have a reason not to send patients. That's a weird thing to say, but there are setups where, the providers are reluctant to send patients to someone else. And that's not our group. Our group is a very equitable group where specialty care is shared among all the different providers, and people get people to who needs to see them. And I think that's a very important part of our group.
But it's still getting top rate care. And I think, different from some other practices that may also have a large geographic scope, we try very hard to make it feel like no matter where you touch our group, you're getting the same care from the doctors that know everything about the care you've received. It's not like you're going to walk into another office and they'll be like, yeah, you saw my partner or someone in our group 20 miles away. I don't know anything about what they did. And frankly, I'm not going to figure that out. I'm me, and this is what I do here. That's not our group. It's very important to all of us. We talk with one another all the time. We all have a huge, significant, interest in seeing this go well, and rely on each other for coverage, for, getting patients the care they need. And it's just a phone call away. Hey, Mr. So-and-so is coming into this office today. Update me on what's going on. And so I can deliver them high quality care. And as a patient, it's important to us that you feel that we're talking to each other.
It is the Urology of St. Louis Cancer Institute. What types of cancers do you specialize in treating there?
We treat all the cancers of the urinary system for men and women, and male cancers related to the reproductive system. So that would mean all men and women with kidney cancers and bladder cancers. And then among men, cancers of the testis, prostate, and then the more rare ones would be like the penile cancers.
Are the big four? Would you call them?
The big four within our specialty, would be prostate, bladder, kidney, testis. And then as Dr. Strope said, there are a few other rare malignancies, but no doubt about it, we encounter them and treat a lot of them. Those are definitely under our purview. And then another one is, which is even rarer still, is cancers of the adrenal gland also at times will fall under our purview.
And I want to make one other point too that's very interesting in urologic oncology. Urologists are the doctors who diagnose the cancer, treat the cancer, and follow up on the cancer in the vast majority of these malignancies, which is vastly different than what patients see in many other types of cancer, where the cancer is fragmented across multiple different doctors. Oh, the GI doctor found the colon cancer, and then the surgeon takes it out, and the radiation doctor does some radiation, and then there's a medical oncologist giving some stuff, but then who's actually doing the follow-up? Well, maybe it's the med-onc, maybe it's the GI doctor does a colonoscopy, but who's actually in charge of the care? It's a very different thing in urology, where for almost all these cancers, we're the ones who are diagnosing, treating, and following the patients for long term. So it really is a long-term patient care journey and partnership with the doctor, which, going back to the point Dr. Auffenberg was making at one other point, where, having your doctor there and having that support team is important, because it's a long-term relationship.
And I think building on that a little bit is although we generally are sort of the home base for a lot of urologic cancers, that's not to say we don't interface very closely with other disciplines. So radiation oncology is appropriate, or radiation therapy is appropriate for certain stages of various of our malignancies. Medical oncologists, who are generally the doctors that are providing chemotherapy or immunotherapy in certain stages of cancer, we work extremely closely with them. Several radiation oncologists are actually a part of our group. They work with us, and so we partner with them very closely. Medical oncology, so that historically has been the field that most commonly is thought of as providing chemotherapy. The landscape has changed a lot in terms of what is available in terms of cancer therapeutics over the last decade. So there are newer agents, immunotherapies, radiopharmaceuticals, things like that, many of which fall under the purview of medical oncologists. Many of those can be delivered sort of in infusion centers and this is where geography comes in, and given the scope of kind of where we are in the metro area, a lot of those therapies can often be given closer to home than having to come all the way into one central location. By virtue of us having practice locations in all these settings, we get to know the local environments very well. So depending on where you're from, if we need to partner with another care provider, we will probably make a different selection or a different recommendation based on what's close to you. You're not always having to come into downtown dealing with the massive parking garage, all the traffic, things like that. Occasionally that's appropriate, and we have the resources centrally when that's necessary, but when it's not, it's very important to us to try and help you navigate a journey, which we know can be complex. And every minute spent in the car, every time dealing with a parking garage that you don't know, or traffic and things like that, adds stress to the journey. And so we try to defray some of that stress by, being strategic about what can we do appropriately closer to home, and when do we need to bring it in more centrally for the greater degree of expertise.
Is prostate cancer the thing you see most?
Yeah, so prostate cancer is the most common urologic malignancy. It's actually the most common solid organ malignancy that affects men in this country.
And can you provide every service that a prostate cancer patient, for example, is going to need at the Cancer Institute?
We provide the vast majority of the care, and this is a really good example of what I was talking about, where urologists are the ones who do the initial diagnosis, do the initial counseling about the types of prostate cancer and what options are available for the patient. And then depending on the stage, grade, everything for the cancer, you might be talking about something that's very slow growing where you're doing surveillance. You might be talking about something where the patient might need surgery or radiation therapy, all of which is provided through our Cancer Institute. You might be talking about hormone therapy, which is provided through the Cancer Institute, advanced oncolytic therapy, which is provided through the Cancer Institute. The place where we then would do the referrals out would be for chemotherapy and some forms of immunotherapy, but not all the forms of immunotherapy, because some of that is done through the Cancer Institute as well. So almost all that continuum of cancer care for prostate cancer is available through our Cancer Institute.
And even for the small segment of patients that do end up getting a referral out for a portion of their therapy, we're not going anywhere. That then becomes a partnership with a multidisciplinary team where we still are often sort of shepherding much of the care. Most of those patients, for instance, are still on hormonal therapy, which we often continue to administer, but we're partnering with a medical oncologist. If some of the newer, chemotherapeutics or radiopharmaceuticals are appropriate, we work with the team. And again, the partners that we've identified in various practice environments, part of our sort of desire to refer to them comes from our feeling that they sort of agree with that strategy, is we're going to continue to work through this as a team so the patient knows where their home base is for their care.
At the outset, I mentioned incredible personalized care, individualized care, and that's sort of what we keep going around here. Can we double down and kind of give me a specific example of where a patient might experience that, where they might get that lost feeling had they gone somewhere else?
Sure. So, I think we have these conversations almost every day with a patient that has a new diagnosis of cancer or something that could be cancer. And I think we are very sensitive to and have walked the journey with many folks that, often that is, perhaps the worst news that person's heard in their life. It's scary, it's stressful, and it's hard to feel like you don't know where to turn in this sort of quagmire you've inherited of angst. And that's where we think sort of both personalized care, but also multidisciplinary team is extremely important. So if a patient is diagnosed within our practice, that we avail them of these services, but even a patient coming who may have started their journey elsewhere, sort of the first touch point is they will meet one of our care navigators, usually over the phone. There's an intake process for, okay, what do we know? What other doctors have been involved? How can we help consolidate the information that's coming from them so our doctors have everything at their fingertips to sort of give you the state-of-the-art recommendations, hopefully try to avoid repeating testing that you've already had that may not be necessary to repeat, and kind of get the whole story in, get you and your family members under our umbrella in a way that it's clear we're bringing in all the information. We'll make it clear to you if we need more information prior to treatment, where to do that, how to do that, and we will help you set those things up with our staff. And then ultimately, sort of once we've had all the intake information consolidated, we then will sit down with you once more to review it all and say, okay, here's specifically what we're dealing with in your given malignancy, and here's the recommendation. And as Dr. Strope was alluding to with the prostate cancer example, but it really applies to all of them, the recommendation can vary broadly based on some of the specifics of one case or another. And that, it's not one size fits all. And that's where our time comes in, and spending a lot of time. Our partners, hold this very dear to what they do as well. We spend the time with you to say, here's first things first. I think every one of these problems becomes a little bit easier with some understanding. There's a million questions. What does this mean for me? What's the long-term look like? If I don't help you understand that, we're not getting off on the right foot, because you're going to be making every step still from a place of anxiety and uncertainty. So first is help you understand and help your family understand what we're dealing with, and then talk through the steps that, that we think are appropriate to address the problem.
Let's talk a little more specifics about clinical trials. That's a big component of cancer care.
It absolutely is. Now, clinical trials come in a lot of different shapes and sizes, and they may not be appropriate for every patient with cancer. Quite frankly, most patients, especially with sort of near their initial diagnosis, clinical trials may not be appropriate. We may be talking more about just the standard therapies that are well established, able to be offered outside of the context of a research protocol. But, in certain scenarios, a clinical trial may be the recommended step for a given cancer, either due to the fact that it would allow a patient access to an advanced agent that is not yet available broadly, or possibly some other regimen for monitoring or treatment that they may just not get outside of a clinical trial because either something about their disease is a little bit more nuanced, or perhaps it's a later in the treatment paradigm. We partner with various institutions as well as industry partners to offer a menu of treatment-related clinical trials for bladder cancer, prostate cancer being the biggest two. And as I said, that is an important focus of our practice for certain patients. It's good to be able to offer that and allow, again, perhaps if we have a patient in a scenario where there may not be another good option, or a trial is looking like it may truly be the best option despite other options available, we now have the opportunity to offer that to patients as well, and again, not need to refer them out for these services.
So it's not only personalized care, it's advanced.
We strive to be the pinnacle no matter what we're doing.
When you talk about personalized care, to me, as someone who could be potentially a patient, that means getting to know you and your staff, right? And having, when you call in or when you come for a visit, to feel like this person knows who I am and knows where I am.
Yes.
I think that's really important. And the reality is, I think, as all health care organizations grow, again, myself on the receiving end of that as a patient too, you notice, it's hard to feel like you know who you're talking to. Do they know anything about you? Things like that. And that's where sort of formalizing the Cancer Institute umbrella of what we do is really important, because it allows us to staff it appropriately in that way, in a personalized way. We have a very select number of folks who, for instance, answer our Cancer Institute phone line. They've been trained to know that, these are patients that may have a little more complexity to their journey than a person without a malignant condition. And, it's important to us that both our patients but our staff feel they have the tools appropriate to get them where they need to. The reality is much of mine and Dr. Strope's days are spent either in the office or in the operating room. And, it can be hard to get a hold of us at a second's notice. One of our responsibilities is to make sure you can get a hold of someone. And that's where staffing comes in. We've trained a very large staff of people that are as passionate about this as we are, with different training backgrounds and things like that, and deployed them to be available to our patients, even if it's not us on the phone answering the phone every second, but there is a very clear path to sort of escalating things to us. And I promise you, we're extremely available, as are our partners, to get you an answer. If it needs to come from us, we'll be on the phone that day. If it can be answered by one of our staffers, they're going to be appropriately trained, and they can help you with your issue as well.
What else would you like people to know about the Urology of St. Louis Cancer Institute, Dr. Strope?
I think that we're here for the patients. I mean, the purpose of making the Cancer Institute is to streamline patient care, give better access, better touch points for the patients to be able to get the care that they need. And that's the whole purpose. It's access and excellence in care.
How do people find out more?
There's many ways you can engage us. I think first would just be our company's website. So stlurology.com, pretty simple thing to remember. If you type that into any web browser, it'll bring you to our website, and you'll see very easy at the top, there's an opportunity. If you need a visit, you can click, for an appointment, and we try that. If it's a malignancy-related condition, that'll connect you directly to our Cancer Institute intake team and sort of get the process going. That's probably the easiest way to reach out to us. Phone call is also an option, online contact. We offer, sort of in-person visits also when appropriate, for things like a second opinion. Sometimes that can be done virtually. Not always, but at times. And so we have also tried to sort of adapt with the times and try and figure out ways to sort of meet patients where they are, even if a car ride isn't in the equation for the first visit. So there's a lot of ways to do that.
Dr. Strope, anything you care to add in closing?
I think the other main point with it too is a lot of patients don't know they're on a cancer journey until it kind of hits them. And I think that's where our group actually excels, because we have that large footprint. We have all of our excellent partners in the group. And when that cancer journey starts, they don't have to leave. They may not realize they're on a cancer journey. It may have been there was some blood in the urine. It may have been there's an abnormal lab test. But that cancer journey can start with what wasn't seeming like it was going to be a cancer journey. They get the workup they need. They get the care they need. And they don't have to leave the environment that they've started in and started to become comfortable in. The Cancer Institute is there for them within our practice and to expand to the next level of care that might be needed.
I don't think you can have more personalized care than that, right? You're not going to farm them out. They're with you start to finish, and
It's
hopefully great outcomes. They are Drs. Greg Auffenberg and Dr. Seth Strope, and it is the Urology of St. Louis Cancer Institute. Doctors, thank you.
Thank you.
Thank you.